So today we're going to look at the joints. This is going to be the third section on the skeletal system, looking at the joints. So this is a little bit shorter than our other sections have been. So joints or articulations. So an articulation is a site where two or more bones are going to meet. Joints hold bones together, but they permit movement. There are some joints that don't move, though. So it's a point of contact between two bones, between cartilage and bone, between teeth and bone. It's the weakest part of the skeleton, so it's where injury is most likely to occur. It's going to help give the skeleton mobility, help hold it together. One of the things that we frequently study in anatomy and physiology, is a disarticulated skeleton. It's one where the bones have been separated. So all joints fall into one structural class and one functional class. Structural classes are going to focus on what binds the bones together, whether or not a joint cavity is present. So there's three structural classes. Fibrous joints have fibrous material between the bones. Cartilaginous joints have cartilaginous material between the bones. And a synovial joint is going to have a space between the bones. The functional classification is based on how much movement. So the three functional classes are synarthroses. These are considered immovable joints. Amphiarthroses are slightly movable, and diarthroses are freely movable. So when we look at the fibrous joints, these are joined together by fibrous tissues. There's no joint cavity. So these tend to be the least movable or the most immovable. These will include the sutures, the syndesmoses, and gomphoses. So sutures are going to occur between the bones of the skull. So they are interlocking joints. So you can even see in this picture here how they kind of weave together. They also do that three-dimensionally, and they're filled with connective tissue fibers. So even though they are held together tightly, it does allow for growth during youth and a little bit of movement of the skull during the birth process. But in middle age, the skull bones are going to fuse. So in an adult, when it's completely fused, we refer to it as synostosis. So this lets you see the three-dimensional locking together of the sutures. So the syndesmosis, here the bones are connected by a fibrous tissue ligament. So they're immovable to slightly immovable, so usually in amphiarthrosis. This would include the connection between the tibia and fibula and the radius and ulna. So you can actually feel what this feels like if you press forwards and backs, anterior and posterior, on your lateral malleolus here on your ankle. You'll feel there's just a little bit of give to the joint. So gomphoses, this is going to hold a cone-shaped peg in a bony socket, otherwise known as a tooth. So they are immovable, as synarthrosis. Keep in mind, it's a relative term. If you've had braces, you know that you can make them move, and when you take the braces off, if you don't do something to hold them in place, they move back. So the tooth is going to fit in the socket here, which is the alveolar process. So cartilaginous joints, the bones are tightly connected by fibrocartilage or hyaline cartilage. So they do not have a joint cavity. So they're either synarthroses or amphiarthroses. So this includes the synchondroses. So synchondrosis actually means without cartilage, and the symphyses. So a synchondrosis is the bar plate of hyaline cartilage that unites the bones. Eventually, this cartilage will turn to bone in a synchondrosis. So they are considered synarthroses. So the epiphyseal plates of children, so that is before it has turned to bone. This would also include the joints between the costal cartilage of the first rib and the sternum. So here you can see this is where you have this temporarily hyaline cartilage joint. And here you can see between the first rib and the sternum. So the symphysis, the hyaline cartilage is going to cover the articulating surface of the bone, and is going to be fused to an intervening pad of fibrocartilage. So fibrocartilage is what's going to connect them. They're considered amphiarthrotic, and they're designed for strength and flexibility. So this would include the intervertebral discs of the spine and the pubic symphysis of the pelvis. So here you can see you've got fibrocartilage making up the discs of the spine, and here in the pubic symphysis. So the synovial joints have articulating bones that are going to be separated by a fluid-containing joint cavity, which is the synovial cavity. All of them are diarthroses, so this would be all your limb joints. This is actually most of the joints in the body. They're all going to have articular cartilage to help absorb shock and reduce friction. They're surrounded by an articular capsule. There's basically thickenings in the fibrous capsule that we call ligaments that are going to help to support the joint. On the inside surface of the capsule is the synovial membrane. So it's the lining of the capsule. It secretes synovial fluid, and it will have hyaluronic acid in there to make it slippery. It's going to help bring nutrients to the articular cartilage and fill that cavity, which is the space inside the joint. So here would be your joint cavity that's going to have the synovial fluid. So here you would have some ligaments on the outside. So we do have some things to help reduce friction in these joints since they move around a lot. The bursae are flattened fibrous sacs that are going to be lined with synovial membranes, and they'll have synovial fluid in them. This is common where you're going to have ligaments, muscles, skin, tendons, or bones rubbed together. It's almost like, I like to think of it like the tongue in a shoe. That's to help keep the laces from rubbing on the top of your foot. So a tendon sheath is an elongated bursa that wraps completely around a tendon. So here is an example of a bursa so that you don't have this tendon rubbing directly on the bone. So bursitis is when you have inflammation of that. So here we can look at the different types of synovial joints. So they have different shapes that are going to allow for different movements. So a planar joint is going to be between the navicular and second and third cuneiforms of the tarsal of the foot. So it's going to allow movement in these four directions. So condyloid joints with the wrist. So it's moving in these four directions, but it's more sliding. Saddle joints between the trapezium of the wrist and the metacarpal joint of the thumb. Hinge joints. So this is an open and closing movement. It moves like a hinge on a door. Pivoting joints, they're going to allow twisting. And then the ball and socket joints, these will allow twisting as well as circumduction. So a gliding or planar joint, here the flat planes are going to glide over each other. This is what you would have in the intercarpal and intertarsal joints. Hinge joints, so you've got a cylindrical projection that fits into a notch. It looks a lot like what you have as a hinge for a door. The ulna and humerus will do this, so this is going to allow you to bend your elbow. The tibia and femur, it allows you to bend your knees, and your interphalangeal joints in your fingers, between your fingers and your hands. Pivot joints, you've got a rounded end of one bone protrudes into a sleeve or ring of bone or ligaments. So you have this at C1 and C2 that allows you to turn your head side to side. You also have it at the proximal radial ulnar joint that allows you to rotate your forearm. Condyloid joints, you've got a rounded or convex articulating surface of one bone that fits into a cave or depression on the other side. This would include the radiocarpal joints, so between the hand and the wrist, and the metacarpal phalangeal joints. So a saddle joint, each articular surface is going to have both convex and concave surfaces in here. It's shaped like a saddle. So the carpometacarpal joint of the thumb is one of these. This is a special case of a condyloid joint. So the thumb is the only place where you have this. This is what gives us as humans an opposable thumb. So ball and socket joints, you've got a spherical or hemispherical head of one bone that's going to articulate in a cup-like socket. This gives the greatest rotational flexibility. This is what you're going to have in the shoulder and hip. So it's a special case of a condyloid joint that's capable of circumduction. So this is an example of a synovial joint here. So you can see on a living tissue there isn't big gaping spaces between them. So you do have the joint space that is your synovial joint cavity. You've got the articular cartilage that's covering the ends of the bones, and then the articular capsule is around the outside of the joint. So other special features we have here, we have a lot of accessory ligaments here. Since these are freely movable, they're going to need some extra help with stability. So extracapsular ligaments are outside the joint capsule. Intracapsular ligaments are within the joint capsule. So your anterior and posterior cruciate ligaments are examples of these. With each joint, these ligaments do get their own names. Articular discs or meniscus, or the menisci, these are pads of fibrocartilage. They'll be attached around the edges to the capsule, and it allows two bones that have different shapes to fit together tightly. So it will increase the stability of the knee and allow for smoother movement. So if somebody has a torn meniscus, their movement is not going to be smooth. One of the classic things that you'll see with that is it will lock up while it's in motion. So the bursae are sac-like fluid-filled structures. So this is going to be used when you've got skin or bone or tendon and bone or ligament and bone potentially rubbing. So one of the things people often ask is, cracking your knuckles bad for you? At this point, there is no evidence that it causes arthritis. It may annoy people around you, but because they're not a weight-bearing joint, we don't see any arthritis that goes with them. There can be other things that could cause arthritis there, but that doesn't seem to have an increase with people who crack their knuckles. Cracking other weight-bearing joints of the body just to crack them is probably not a good idea. It is different than having an adjustment to the bones, which is a specific movement of something that is locked up and not moving properly to provide corrective motion. So arthroscopy is the examination of a joint. The instrument's about the size of a pencil, and they can actually go in and remove torn knee cartilages and repair ligaments. The advantage is it only has a really small incision, so it's better healing. This is a fairly common injury, so they're actually quite good at repairing these things. These cartilages are not going to heal on their own without a surgical intervention. Arthroplasty is the replacement of joints. One of the more common ones is the hip total replacement, where they're going to replace the acetabulum and the head of the femur. So some of them are metal, some will be ceramic and metal in there. There's a couple different ways that they go about doing them, but they're a fairly common procedure and tend to have a pretty good outcome. So sometimes it will be a plastic lining in the socket and a metal head. Knee replacements are also fairly common. So nerves to the joints are branches of nerves to the nearby muscles. So your joint capsule and ligaments are going to have pain fibers and sensory receptors in there. That's going to allow you to know where they are, but it will also allow you to know when there's an injury. So the blood supply to the structures of a joint are branches from nearby structures. So they'll supply nutrients to all the joint tissues except the articular cartilage, which is supplied from the synovial fluid. So it is not a great nutrient supply to the articular cartilage, hence they don't necessarily heal well. So sprains versus strains. Sprain is twisting of a joint that stretches or tears ligaments. There's no dislocation of the bones, but it may damage nearby blood vessels, muscles, or tendons. So you can have some significant bruising, some swelling and hemorrhage in the blood vessel. So ankle is a joint that is commonly sprained. Strain is considered a little bit less serious. It's overstretched, or you may have partially torn muscle. Generally, you are going to see the two things go together because they're the result of moving a joint well beyond its normal range of motion. So the bursae, as we've mentioned before, are fluid-like sac-like extensions of the joint capsule. They're going to reduce the friction. You'll see these where skin or tendons rub over bone. Tendon sheaths are a tube-like bursa that will wrap around the tendon. You'll see them at the wrist and ankle, where you have a lot of tendons come together but in a confined space. So bursitis is chronic inflammation of the bursa. Generally, you have to stop doing the movement to get it to go away. So things that are going to influence joint stability, the articular surfaces. Their shape and condition are important to have a smooth functioning joint. Ligaments, they're made up of dense regular connective tissue. It only stretches about 6% before tearing. When you're stretching, a lot of times what you are resetting is the nervous system. It would take about 3 minutes to actually have any tissue change and stretching going on. And most of the time when you're stretching, you're not holding it for 3 minutes. Muscle tone is the most important. So when you are doing a resting activity, there's some minimal level of contraction operating at all times. You're not just hanging there flaccid and loose. So muscles, tendons, and ligaments are supplied with sensory nerve endings that are going to give feedback control of the limb and body position and posture. When you've had an injury, that's one of the things that is going to have reduced function, therefore making you more likely to re-injure it again. When you're walking along, if your ankle starts to roll to the side, these things are going to give feedback in a healthy ankle that you bring it back underneath your body. And an ankle that's been injured multiple times, that feedback is not going to be as quick, and so it's more likely to just continue to roll outside of the position and re-injure. Hormones can influence this. Relaxin from the placenta will loosen the pubic symphysis. It can also increase some of the flexibility in the other joints. Disuse. With this, you're going to have a decrease in synovial fluid, decreased flexibility of the ligaments, and reduced size of the muscle. So that's one of the downsides to an injury. If a person decides to just do rest, you're going to have a lot of repair that needs to happen as a result of the disuse to regain all the normal function. So stability is important to maintain joint integrity and avoid injury. So movements, uniaxial is in one plane, biaxial in two, multi or triaxial is going to move in 3 or more planes. So gliding movements, here you have a flat bone surface glide over another similar surface. This would be the intercarpal or intertarsal joints. It's also the flat articular process of the vertebrae. So wrist moving side to side is an example of gliding. With angular motion, here you're going to have a bending movement that's going to change the angle of the joint. So flexion is going to decrease the angle, where extension is going to be the opposite. The angle is increased. Hyperextension is when it moves beyond 180 degrees. So this allows you to see some angular movements in there. Flexion, extension, flexion and extension at the head, at the torso. So more angular movement. Abduction is going to move away from the midline. Adduction is going to move towards the midline. Circumduction is movement in a cone space. So abduction, you can see the arm moving out to the side. Adduction, pulling it in. Circumduction would be swinging this arm all the way around in the big circle. Rotation is the turning of a bone around its own long axis. So you have this between C1 and C2, the first two vertebrae. You have it at the hip and shoulder joints. The shoulder joint is shallower than the hip, so it is less stable. So you can see moving the head. You can turn your foot out to the side here by turning your whole leg at the hip joint. Special movements, opposition. So that's being able to pinch the thumb to the fingers. If you look at your pets, your cat or dog, they do not have opposable thumbs to be able to pinch things. If you feed a squirrel, when it grabs the nut from you, it's got to use both of its little paws to grab it because it doesn't have an opposable thumb to pinch it. Supination and pronation are at the forearm and wrist here. So supination, the radius and ulna are parallel. Some people like to think of it like carrying soup where the palms are up. Pronation rotates the radius over the ulna. The palms are down. So protraction and retraction, you can have this at the mandible. You can also do this with your shoulders. Elevation and depression, so moving the bottom jaw going up and down. Dorsi and plantar flexion. Dorsiflexion pulls the toes up towards the head. Plantar flexion points them down towards the ground. Inversion and eversion are going to occur at the foot and ankle joint here. Inversion, so this is going to be the middle of the person's body on this side, turns the sole towards the midline. Eversion turns the sole away from the midline. So if we look at a specific joint here, the knee is the largest and most complex joint in the body. It's only partially closed by the capsule. It's open at the ventral side, but you've got anterior ligaments and tendons that are going to secure this ventral part. So the quadriceps femoris tendon and the patellar ligament are going to help do that, as well as the medial patellar retinaculum. Other ligaments in there, the lateral patellar retinaculum, the tibial collateral ligament, and the fibular collateral ligament. So on the inside, it's also going to be secured by the articular capsule, the oblique popliteal ligament, the arcuate popliteal ligament, other tendons. Internally, you've got the anterior and posterior cruciate ligaments, the lateral meniscus, and the medial meniscus. So this is a parasagittal view of the knee. So it's kind of at an angle here. So you can see you've got your anterior cruciate ligament, your posterior cruciate ligament. Got the bursa, the quadriceps tendon, the subpatellar bursa, the deep infrapatellar bursa, patellar ligament, the synovial cavity, and the lateral meniscus, help holding things into place. So with the anterior view here, now you can see the lateral and medial meniscus. You can see these anterior and posterior cruciate ligaments, how they cross on the inside. The fibular collateral ligament is going to run down the lateral side. And then your tibial collateral ligament is going to run down the medial side. And then you've got the quadriceps tendon coming into the patellar tendon here that's going to make that large bump you feel just below your kneecap on the front of your tibia. So arthritis is inflammation of the joints. Osteoarthritis is due to wear and tear. This is very common. About 85% of Americans will develop some form of this. Most of the time it's just treated with the NSAIDs. Rheumatoid arthritis, this is an inflammatory condition. It's due to an autoimmune response. So this is in a little more than 1%, and it tends to attack the extremities most often. Different types of arthritis will have tendencies to affect different joints. So this likes the hands, feet, and the ankles. It can progress to ossification and fusion of a joint. So when a joint is fused, we don't break it apart. The person has just lost that motion. Gouty arthritis, this is due to the buildup of uric acid crystals in the joint. So the big toe is classically affected with this. There is a genetic component to that. So with rheumatoid arthritis here, you can see the joints being affected here. It's autoimmune, the cartilage is attacked. You'll see inflammation, swelling, and pain, and then eventually fusing the joint.